According to the American Cancer Society, over 13 million cancer survivors are living in the United States today. Cancer is the second most common cause of death in the U.S. behind heart disease, but cancer-related deaths have continually declined in the past 2 decades.
Our incidence for cancer overall has remained relatively steady. For some of the cancers, we've been able to intervene very early and also have a lot of preventative endeavors. So we've actually have decreased some of those cancers.
Hello, Dr. Tranakas.
2 exceptions to this trend are pancreatic and liver cancer.
Well, for liver cancer, we know that it is hepatitis related. So as we're seeing more patients with hepatitis, we can get more of those liver cancers. With pancreatic malignancies, we really do not know a lot of the triggering factors, although as we delve into more gene-related issues and we're finding certain genes are related to the risk for pancreatic cancer, then we're actually seeing a lot more of that. There isn't any one specific reason why the risk for pancreatic cancer is increasing, other than, again, mostly in inherited forms.
Unfortunately, people can also inherit a poor diet. The World Cancer Research Fund estimates that 1/3 of all cancer cases reported in economically developed countries like the U.S. are related to obesity, physical inactivity, and/or poor nutrition.
A lot of times we know that there is a direct link between nutrition and the incidence for cancers. For instance, a diet that is low in fiber, such as it happens in this country, we have a higher risk for developing colon cancer. The African nations, which have a much higher fiber content in their diet, have one of the lowest incidence for colon cancer compared to us.
Along with a diet high in fiber, vitamin D is essential in protecting against cancer.
Individuals with low vitamin D levels are more prone to certain types of cancers as well as other issues.
Despite educational campaigns on awareness, prevention, and early detection, a person's socioeconomic status is still a major determiner of risk.
It's because of their diet. Obviously, they're eating a lot more processed foods because of the economics at hand. Processed foods are much less expensive, and they're much more prevalent in those lower income neighborhoods. Also, a lower socioeconomic group has a tendency of having less access to good quality medical care, and therefore a lot of times when we find these cancers, they have a tendency of being much more advanced than we would like.
When a patient is diagnosed with cancer at Broward Health, a team of professionals consult each other to come up with the best plan of action.
We have our weekly tumor conferences where we discuss new diagnosed patients in a multidisciplinary fashion, where we have medical oncologists, radiation oncologists, plastic surgeons, social workers, and surgeons all together in a room that we can discuss a patient's case and present all of their circumstances so we can come up with the best plan for that individual.
In one case, the panel may opt for surgery first, while in another situation, they may go with radiation and chemotherapy first.
So that multidisciplinary approach becomes very important, so that way we're not seeing just one expert and then just following with one opinion, but gathering a variety of opinions all together so we can come up with the best treatment plan for that individual.
The future for all cancer treatment seems to be focused on a molecular level.
We are finding certain similarities in terms of the biological behavior of a lot of these cancers.
So instead of developing medications specifically for breast cancer or pancreatic cancer, medications would be developed for cancers with similar biological behaviors.
So our opportunities to then be able to attack these cancers and achieve much better cure rates has tremendously increased.
Dr. Tranakas is optimistic that cancer rates will go down, and ultimately, instead of being a death sentence, cancer will become a chronically manageable disease.
So as long as you're taking this form of therapy, then the cancer may not be completely cured, but it's not going to progress, and if we can hold it at bay, that's a very good second best to getting it completely cured.